Welcome to the Vox Herald podcast. Folks, I'm San Juan, and today we're diving into a health crisis that's sending shockwaves worldwide, with ripple effects right here in New Brunswick. The news is stark. President Donald Trump's second administration has slashed funding to critical global HIV/AIDS programs, including the United Nations UNAIDS and the US-led PEPFAR, threatening decades of progress in the fight against HIV. UNAIDS warns of 6 million new infections and 4 million additional deaths by 2029. If the gap isn't filled, this isn't just a distant issue. It's a global health threat that could reach Canada's shores, including communities in Moncton, Fredericton, and beyond. The question is, can Canada step up to lead the response? Experts like Dr. Julio Montaner in British Columbia and Dr. Eric Arts in Ontario are calling on Ottawa to double down on funding to the Global Fund, urging Canada to rally other G7 nations. But what does this mean for New Brunswick? How does a global funding cut impact local clinics, Indigenous communities, or Acadian populations? And what can Health Canada do to prevent a resurgence of HIV/AIDS? Today, we'll unpack the history of Canada's role in global HIV/AIDS efforts, analyze the mechanics of these funding cuts, hear from stakeholders across the spectrum from Health Canada to local doctors in New Brunswick, and explore what this means for the future. We'll also look at how other countries like South Africa are stepping up and what Canada can learn. Stick with us, because this is a story of hope, urgency, and the power of collective action. Let's get started. To understand the gravity of Trump's funding cuts, we need to rewind and trace the history of the global fight against HIV/AIDS, a battle Canada has been part of for decades. HIV/AIDS emerged in the early 1980s, a terrifying epidemic that claimed millions of lives. By the 1990s, it was a global crisis, with sub-Saharan Africa hit hardest. In Canada, cities like Vancouver and Toronto saw devastating losses, particularly in marginalized communities. This spurred Canadian researchers, like Dr. Julio Montaner, to pioneer antiretroviral therapy ART, a multi-drug cocktail that transformed HIV from a death sentence to a manageable condition. Montaner's work at the BC Centre for Excellence in HIV/AIDS helped shape the UN's 909090 targets. By 2020, 90% of people living with HIV should know their status, 90% of those diagnosed should receive treatment, and 90% of those treated should achieve viral suppression. Canada's contributions didn't stop at research. In 2002, Canada co-founded the Global Fund to fight AIDS, tuberculosis, and malaria, a partnership pooling resources from G7 nations to support low- and middle-income countries. Canada pledged $1.21 billion for 2023 to 2025, a 30% increase from prior years, but dwarfed by the US's $8 billion commitment. The US also launched PEPFAR in 2003 under President George W. Bush, a program credited with saving 26 million lives by providing HIV treatment to 20 million people across 54 countries. PEPFAR funded 70% of the global AIDS response, making it the backbone of international efforts. In New Brunswick, the HIV/AIDS response has been quieter but no less critical. The province has a lower HIV prevalence than urban centers like Toronto, with about 1.5 cases per 100,000 people in 2023. But rural and Indigenous communities face unique challenges. Limited access to testing and treatment, coupled with stigma, has made outreach difficult. Organizations like AIDS New Brunswick have worked to bridge these gaps, often relying on federal funding tied to global health initiatives. Health Canada has supported these efforts through public health campaigns and partnerships with provincial health authorities, emphasizing prevention and testing. Globally, progress was remarkable. By 2024, new HIV infections dropped 40% and AIDS-related deaths fell by over 50% since 2010. Thanks to ART and prevention programs like pre-exposure prophylaxis, PrEP, the UN's goal to end AIDS as a public health threat by 2030 seemed within reach until January 2025, when Trump's executive order froze all U.S. foreign aid, including PEPFAR and UNAIDS funding. A February 2025 waiver allowed some life-saving treatments to resume, but the damage was done. Clinics closed, staff were laid off, and prevention programs stalled. This isn't the first time global health funding has faced cuts. During the 2008 financial crisis, some European donors scaled back, but the U.S. stepped up through PEPFAR. Now, with the U.S. withdrawing, the gap is unprecedented. In Canada, Health Canada's role in global health has historically been collaborative, channeling funds through the Global Fund and supporting research partnerships like Dr. Art's work in Uganda. But Canada's contributions have often been modest compared to its G7 peers, raising questions about its capacity to lead. In New Brunswick, the 1990s saw early HIV/AIDS advocacy through community groups, often supported by federal grants. These efforts built trust in Acadian and Indigenous communities, where stigma remains a barrier. Health Canada's 2018-23 HIV/AIDS strategy emphasized equity, targeting high-risk groups, like Indigenous peoples, who account for 10% of new infections. Despite being 5% of Canada's population, the current crisis threatens these gains, as global disruptions could strain domestic resources. Let's break down the mechanics of Trump's funding cuts and their ripple effects. Starting with the specifics, on January 20, 2025, Trump signed an executive order halting all U.S. foreign aid for 90 days, pending a review. This froze PEPFAR's $7.5 billion budget, which supports HIV treatment for 20 million people, including 550,000 children, across 54 countries. In February, the U.S. terminated its partnership with UNAIDS, cutting two-thirds of global HIV prevention funding for low- and middle-income countries. A limited waiver allowed some PEPFAR-funded treatments to resume, but prevention programs, including PrEP distribution, were gutted. The impact was immediate. Clinics in countries like South Africa and Kenya shut down, unable to pay staff or restock medications. UNAIDS reports disruptions in 55 countries, with patients hoarding drugs or rationing doses, risking drug-resistant HIV strains. The cuts also halted research, with the National Institutes of Health (NIH) terminating 145 HIV-related grants worth $450 million, including a $258 million vaccine program. UNAIDS predicts 6 million new infections and 4 million deaths by 2029 if funding isn't restored. Why did this happen? Trump's administration, led by figures like Secretary of State Marco Rubio and Health and Human Services Secretary Robert F. Kennedy Jr., prioritized America First policies, arguing that U.S. taxpayers shouldn't bear the burden of global health. Trump himself said in May 2025, "The United States always gets the request for money," urging other nations to step up. Critics, including UNAIDS Director Winnie Byanyima, call this cruel and short-sighted, noting that HIV's global nature means unchecked spread could reach wealthier nations, including Canada. In Canada, Health Canada oversees global health contributions through the Department of Global Affairs, which funds the Global Fund. Canada's $1.21 billion pledge for 2023-2025 is significant but pales compared to the U.S.'s $8 billion. Dr. Eric Artz and Dr. Julio Montaner argue that doubling this commitment could stabilize programs in countries like Uganda, where Art's research partnership faces layoffs. The Global Fund distributes funds to 60 low- and middle-income countries, supporting ART, PrEP, and testing. Without US support, these countries, including South Africa, have increased domestic budgets by 8%. But it's not enough. For New Brunswick, the cuts indirectly threaten local efforts. AID's New Brunswick relies on federal grants, some tied to global health initiatives, to fund outreach in rural areas like Miramichi. If global HIV cases surge, Canada may face increased demand for treatment, straining resources. Indigenous communities, already at higher risk, could see rising infections if prevention programs falter. Health Canada's role is to coordinate with provinces to ensure equitable access, but budget constraints could limit this. The mechanics of PEPFAR and UNAIDS are worth explaining. PEPFAR, launched in 2003, integrates U.S. agencies like USAID and the CDC to deliver ART, PrEP, and prevention. Education, it's like a global supply chain for HIV care, ensuring drugs reach remote clinics. UNAIDS, meanwhile, sets global standards and coordinates multi-country responses, acting as a command center for the AIDS fight. Losing U.S. funding is like pulling the plug on both, leaving clinics and researchers scrambling. Let's hear from the voices shaping this crisis. Winnie Byanyima, UNAIDS director, calls the cuts an act of unbelievable cruelty, emphasizing that global cooperation is essential. She points to South Africa's response boosting domestic budgets and building chronic medicine systems as a model, but stresses it's insufficient without international support. Dr. Julio Montaner, a Canadian pioneer in HIV treatment, labels the U.S. withdrawal criminal negligence. He urges Canada to lead by doubling global fund contributions, arguing that Health Canada has a moral duty to fill the gap. "This isn't charity, it's self-preservation," he told CBC. Dr. Eric Artz, based in Ontario, echoes Montana, focuses on practical impacts. His Ugandan partnership faces staff cuts and treatment disruptions, which could increase infections that eventually reach Canada. He calls for Health Canada to lobby G7 allies like Japan and Germany. New Brunswick stakeholders, like AIDS, New Brunswick's executive director, highlight local vulnerabilities. Rural clinics struggle with outreach, and Indigenous communities face stigma-driven barriers. Federal funding cuts could force layoffs, reducing testing in areas like Elsipogag First Nation. Health Canada has not commented directly, but Global Affairs Canada oversees its global health contributions. A 2022 statement reaffirmed Canada's commitment to the Global Fund, but no new pledges have addressed the 2025 crisis. U.S. officials, including Trump and Rubio, defend the cuts as prioritizing domestic needs. Critics like PEPFAR warn of 143,000 new U.S. infections and $60 billion in costs if prevention fails. Global health experts, like Dr. Madhukar at McGill, see an opportunity for Canada to lead, but warn that no single nation can replace the us. They suggest a G7-lead coalition. In New Brunswick, the impact is subtle but real. AIDS New Brunswick serves 200 to 300 clients annually, many in rural or Indigenous communities. Federal grants, often linked to global health budgets, fund mobile testing units in places like Bathurst. If global cases rise, Canada's immigration and travel patterns could increase local infections, overwhelming clinics. Nationally, Canada's HIV prevalence is low, 0.2% of adults. But disparities persist. Indigenous peoples face infection rates 2.7 times higher than non-Indigenous Canadians. Health Canada's 2018-23 strategy targeted these gaps. But funding constraints could stall progress. Compared to the U.S., where the CDC spends $1 billion annually on HIV prevention, Canada's budget is smaller, making international cooperation critical. Globally, agencies like the FDA and EMA face similar pressures but haven't cut funding. South Africa's response increasing domestic spending offers a model, but its scale is limited. Canada could learn from its decentralized drug distribution systems. The long-term risks are dire: a resurgent HIV epidemic, drug-resistant strains, and strained healthcare systems. Canada could lead by doubling global fund contributions to $2.5 billion, rallying G7 partners, and expanding Health Canada's role in global health policy. Solutions include increase funding, match U.S.-level commitments proportionally, strengthen local systems, support New Brunswick clinics with mobile units, and telehealth.global coalition, lead a G7 task force to replace PEPFAR funding, Research Investment Fund, Canadian-led HIV vaccine research. The HIV/AIDS crisis is a test of Canada's leadership. Health Canada, alongside New Brunswick's communities, can drive change. Listeners, share your thoughts on X. How can Canada step up? Visit Health Canada's website for resources on HIV prevention. In June 2025, Health Canada issued a new guideline promoting PrEP access in rural areas, including New Brunswick's Acadian regions, to curb HIV spread. This aligns with efforts to mitigate global funding cuts.